I'm Jeff Surgent with Muscle Movement Therapy, where we have a different approach to get better results. One of the last areas that I kind of want to always talk about with our phases of care is that we did talk about the safety net that we do create. We're doing re-exams and re-evaluations with our patients pretty often, and I want to see regular changes. One of the things for me is I want to see some things getting better, even sometimes getting worse, because then we can prove that it's a mechanical thing. If something's not getting better or worse, those are one of the frustrating cases for me, and those are where we have to start working around and start thinking a little outside of the box of like the horses versus the zebra type diagnosis that we can see. So this is kind of where we're going to dive into a little bit more of the other category. I refer out with orthopedics, pain management. We send out for MRIs, we send out for x-rays. So we're not always just taking an isolated effect. One, we want to make sure it's getting good results. And sometimes the treatment, if the treatment can help also be the diagnostic criteria for it. And when I see patients that come in from other providers, sometimes the hints of what they did can help me push ahead of what other things we need to go to. I don't need to go down and beat my head down the same wall that they did. This is where that clue, that instance of, oh, I did this, I did that, and it still wasn't getting better. I might already start jumping into getting some images, doing some blood work, getting into that kind of stuff, or start thinking about it differently, because that has also been a clinical trial of what may not or may has been working. So it's just an important aspect that, you know, we don't always, I try to get the best results, and I'd love to say that I get 100% people better, but this is a real life situation where we have to see some people that are refer out. In some cases, this is where today I had a Tarvalov cyst patient. Not much I can do for that. That is something that's going to be something managed more by an interventionalist. And then even I have one where we're working with pain management, where we're getting cortisone injections, and then they're following up with us for rehab and manual therapy type concerns. So it's working as a team, getting the best results for our patients.